her or another form, either it be sexual abuse, either be domestic violence or workplace harassment. And ironically, when we look at the data, what happens with the perpetrators, sometimes we feel that they have a sort of impunity because we have so low conviction rate, around 5%. And even if we further go deeper into the data, like I was going through data since 21 to 23, I came across that around out of 32 cases of GBV, 10,000 cases were there were cases of acquittal even before framing the charge. There is a provision under Pakistan CRPC under section 249 and section 265K that courts acquitted the accused. The reason best known to those courts, either the complaints were frivolous or there are chances that there was not incriminating material when the investigation officer or prosecution submitted the case. So the point is, it is a very challenging thing. We have to monitor it technically. So I am personally very happy that UNFPA came up with this idea, case management workers. It is very important because they are the respondent. They have to extend care to the victims. So I hope that these 2 days sessions will be pragmatic and meaningful and will bring change. At the end, I am again grateful to our development partners, our dear colleagues, and the representatives of civil society organizations, and particularly the trainees who joined this session and earlier they received the capacity building trainings. Their interest will matter a lot. So best wishes to all the participants. Thank you so much.
Thank you so much, Dr. Lahari. That was absolutely superb. I'd like to now invite Dr. Gulnara to give her opening remarks. Dr. Gulnara is the Deputy Representative for UNFPA Pakistan. Please, if you could, Doctor. Thank you. A round of applause, please.
Honorable Mr. Arif Lahari, Director of Ministry of Human Rights, Ms. Farhad Sheikh, BOD member, SPO, distinguished government officials from Punjab, Khyber Pakhtunkhwa, and certified GBV case management trainers, colleagues and friends. Assalamu alaikum, good morning. It's an honor to join you today at this national conference, Connected for Care, which brings together certified trainers and practitioners of GBV case management from across Pakistan, who have dedicated themselves to strengthening the GBV response system and help empower the vulnerable people, including women and girls survivors of gender-based violence. On behalf of UNFPA, I extend my sincere appreciation to the Ministry of Human Rights, the SPO for their leadership in organizing this important gathering, and to the Embassy of Netherlands and the FCDO for their continued partnership and generous support. Ending gender-based violence is one of the UNFPA core transformative results, adherent in the Sustainable Development Goals, and also which is also embedded as a core in the International Conference for Population and Development. According to the Pakistan Demographic and Health Survey, nearly 1 in 3 ever married women has experienced spousal, physical, sexual, or emotional violence. Yet more than half of survivors never seek help. This silence reflects the deep social, cultural, and institutional barriers that prevent survivors from accessing safe, quality care and support. GBV case management is a structured approach to choose that gap in response that ensures the survivor is informed on her options, her needs, and followed up in a coordinated way, and she receives consistent emotional support throughout her journey. UNFPA works on GBV case management in Pakistan began in 2020, when in response to the challenges posed by COVID-19, we partnered with the Social Welfare Department of KP to build the capacity of social welfare officers, helpline staff, Dar-ul Aman and crisis center personnel on quality standards. Building on this foundation, in 2022, UNFPA, together with the Social Welfare Department of KP and Punjab, launched the GBV Case Management Capacity Building Initiative to harmonize approaches to train staff across the provinces. In 2025, this work extended further when UNFPA, with the support of Women Development Department of Sindh and Balochistan, launched the initiative in the 2 remaining provinces, establishing nationwide coverage of its capacity building efforts. Through this journey, with the generous support of USAID, FCDO, and the Embassy of Netherlands, and in close partnership with the Rosanne and SPO, we have trained service providers from shelters, police, health, helplines, psychological support, and case management cadres across, alongside with the government departments, academic institutions, civil society, and UN agencies. Today, we have a national pool of certified Tier 1 and Tier 2 across Punjab, Khyber Pakhtunkhwa, Sindh, Balochistan, and the Islamabad Capital Territory, a cadre of skilled, committed professionals who are the very reason we are gathering here. This conference marks a new chapter in the journey, moving from individual training cohort towards a connected, sustained community of practice. Over these 2 days, I believe, you will not only reflect on the field experience and challenges, but also lay the foundation for a national alumni forum and mentorship group, a structure that would allow trained professionals to continue learning from one another, supporting one another, and strengthening referral systems long after this conference ends. This is what Connected for Care truly means, ensuring that the survivors we serve are supported by a system that is connected across provinces, across institutions, and across the public and development sectors. UNFPA remains firmly committed for working this journey with the government of Pakistan, our implementing partners, and our donors to ensure that survivor-centered ethical GBV case management becomes embedded in the institutional practice nationwide, both at the pre-service level, through academic institutions, and the service delivery level. We look forward to seeing the outcome of this conference, a body of field experience to improve practices and functioning alumni network, and a concrete action plan for mentorship and coordination, translated into stronger protection for women and girls across Pakistan. And once again, thank you to the Ministry of Human Rights, SPO, our development partners, and most importantly, each of you, the certified trainers, for your continued dedication to this course. Together, let us continue building a Pakistan where every survivor of violence finds care that is timely, compassionate, and connected. Thank you very much.
Thank you so much, Dr. Gulnara. That was absolutely brilliant. I'd like you all to give our esteemed speakers, Dr. Faiz Sheikh, Dr. Arif Lakhari, Dr. Gulnara, a round of applause for their thoughts. You have certainly highlighted the importance of strengthening GBV case management systems, improving coordination, and ensuring survivor-centered approaches across Pakistan. Your insights are valuable, and we are grateful to you for setting the direction for today's discussions. We will now move towards a brief presentation highlighting the journey of GBV case management in Pakistan. This session will provide participants with an overview of key milestones, progress made, and the evolving needs within the GBV response landscape. I would like to invite Dilshad Pari, who is the Program Analyst for Gender and GBV at UNFPA Pakistan, to share the brief journey of GBV case management. Dilshad, if you could please be here. Oh, you're here.
Assalamu alaikum and good morning, everyone. I would like to take you through the journey of case management work that UNFPA has initiated in Pakistan with this brief presentation. Colleagues, if you can give me a clicker, please. Clicker, yeah. So these pictures are from the cohorts that we have trained, and I would like to take you to the overall case management work before we embark on the information related to Pakistan and the journey of case management work. I would like you to have a quick look at this and why the case management training is important. This is Farida is just a name given to a random person. It's not a true story or true case. Farida is facing domestic violence, a mother of 2 children, and she is going through fear, uncertainty, and pain. She is unsure. Her safety and the future of her children depends on her decision. And she is like, am I ready to take the call and help? Should I call the helpline? Will I get shelter if I leave? Will the helpline people treat me well or believe me? What if they call my husband? Should I stay quiet? So this is not only the story of Farida. Most of the women who face violence, they face similar circumstances or same sometimes, and they usually ask themselves all of these questions. And most of the time, or some of the time, they are not sure what to do. That's why the GBV case management work is so important to help Farida and women, girls like her in difficult situations and circumstances. With this, I would like to take you to a bit of statistics in Pakistan. And this data is coming from Government of Pakistan's data, Pakistan Demographic and Health Survey 2017 and 18. That's the latest sort of information we do have on indicators on violence against women. And according to this data, 34% of ever married women, they face violence in their life at least one time. And when I say ever married, I'm talking about the women and girls who are married once in their lifetime, either in marriage or widow or separated or divorcee, but they were married once. So there is no data on the women and girls who were not married. And we know from experience and data and the calls that we get in helplines and the women and girls coming to shelter homes that women and girls who are not married also face substantial amount of violence. So this is very, calculated sort of a statistics which might be tip of the iceberg. And then when you look at the data, Government of Pakistan data, it tells that more than 56% of women, of those women who face violence, they do not seek help. They do not even tell anyone that they have faced violence. They just keep quiet, which talks about our help-seeking behavior, and there can be multiple barriers and multiple factors, and one of them can be absence of ethical, comprehensive, and quality GBV services. However, this shows the help-seeking behavior in Pakistan. And then we know that, according to the same data set, around 18% of girls, they are married under the age, when they are under the age of 18, around 4% when they are under the age of 15. And when girls are married at younger age, usually their likelihood to gender-based violence is higher. So this particular scenario, the context tells us that the magnitude of gender-based violence is quite high, and we as a country and the government of Pakistan has to attend to it. And it's important that these women, they get survivor-centered, quality, comprehensive and timely care, which is possible through investing on case management capacities. Before we, as UNFPA, because UNFPA works on gender-based violence globally as well as in Pakistan as a lead agency, both in humanitarian and development setting, before we started working on case management itself, there were certain enabler steps that UNFPA took. We rolled out the essential service package, human curriculum and roadmaps. These are the few things we did. The first kind of realization or starting point for our services, they were declared non-essential. UNFPA started advocacy with government, provincial governments at that time, and together with government of KP, we developed building the capacity of GBV case workers and social workforce. This opportunity to invest on GBV case management and roll out GBV case management capacity building initiative, which was initiated during that process. That TOT was focused at, it was a kind of a national TOT, but most of the participants were from. So we trained around, 11 tier 1, you will be able to understand what does it mean. At that time, however, there were not much when we realized and government realized that this is a critical capacity and we do not have this synth. So far we conducted 3 TOTs and the number of step down trainings. I will not go into step down trainings, and we implemented these TOTs together with government. These are always anchored with, at government department, social welfare department, women development department, those who are the custodian of social workforce. This training is designed in a way, this particular initiative is designed in a way that, before I go into design, I would like to mention that initially it was, before 2022, it used to be like UN Staff College training. They only used to do it. Now it's, the online training at least is open for everyone. So colleagues and participants sitting here, most of you have done it, but if any one of you want to go and do it, repeat this, the course is available on UN Staff College website. So this course is designed in a way that there is 8 to 9 weeks of online training, online engagement, where we do participate with, and run the sessions, and it's a guided sort of a learning session. And after 9 weeks of training, when they are able to qualify for in-person training, then some of the participants, they get residential in-person training, which is quite, quite rigorous, quite solid. And then there is an international curriculum which we have contextualized for Pakistan. The good thing is, like, it's a global curriculum, it's aligned with standards, protocols, but it is contextualized for Pakistan, so it speaks to our context as well. And it's a self-paced learning for frontline GBV workers. Its sessions are interactive, there are quizzes, discussions, relevant for everyone. People who are persons with disabilities, they need different or alternate communication models. They can also access these material, and they give repeated access to technical materials. So whenever there is a need, you can go to it and you can access those material. It's a comprehensive feedback mechanism is inculcated within the training. So during the training, every participant gets individual or in teams feedback mechanism, and there is opportunity to improve the skills and understanding. So after that in-person training, so far in the in-person trainings, we have trained, as I mentioned, 3 cohort, and this is the detail. We have tier 1 trainers, 31 in Pakistan, which is good number, of course, not enough for a country, for a big country like Pakistan, but it's a good number. Tier 2 trainers 20 and tier 3 18. Here I would like to explain for our colleagues sitting here from government, those who have not attended the training. Just the design of it is like, once you are a tier 1 trainer, you can be a lead facilitator. You are allowed to conduct session independently, and tier 2 are the co-facilitators. They are qualified co. So from here you can see this is quite a demanding training. It's participants, trainers, they really have to work hard to earn tier 1 and tier 2. Government departments, CSOs, UN agencies, academic institution, organization for persons with disabilities, they were the participants, and we have trained these stakeholders through our TOTs. This particular training has a dedicated module on the case management of cases of sexual exploitation and abuse, which is a UN-wide commitment, and we are very committed to this, and we train stakeholders on this. And taking this module, UNFPA has also dedicatedly conducted training on this specific module. There is a dedicated module on case management of cases for married girls as well, so that takes into account the rights of children, well-being of children, and best interest of children. So far the impact, of course, this is just a key, and participants, trainers, and colleagues sitting here, they will be able to talk more about it. It sets out a clear kind of standard for GBV service providers, for government, for those who are working or coming across or interacting with survivors. Helplines, Darul Amans, shelter homes, women protection centers, and data that is collected or service data provided at health level, police, prosecution. It really sets out clear guideline for them, minimum standard for them. As a result of it, we have a pool of trained people in the country. It's not available in all countries. Most of the countries, they request other countries whenever there is such capacity building required, but we are lucky to have at least 31 tier 1 certified trainers. So this is a good progress, and because of it now within the government, these people, they are also advocating for better services, for quality services. They do understand what are the principles of survivor-centered approach. So one impact is that now within the government the change has started. And institutionalization of case management, after the TOTs, there was a realization that UNFPA or any other development partner will not be able to continue doing TOTs forever. So there has to be institutionalization within the government system, and institutionalization at 2 levels. One is like at service delivery level. We know that there are service providers who are hired, they are going to stay there, their capacity building is important, so government has to take care of it, institutionalize it within its own training institute, within its own system. And within academic institution, there should be enough content, enough resources in degrees like social work, psychology, gender studies, because usually these are the people who come to GBV services or GBV service provision departments. So we do have good examples from KP and Punjab here, and Sindh and Balochistan are also following. They have initiated the process. So institutionalization that we have done. And we realized that after the investment on case management, there was a bit of appetite and openness from the donor development partners as well. They are ready to invest on it, and UNFPA together with government of Embassy of Netherlands and then FCDO, we were able to make good investment on this. And Gulnara since already has appreciated their efforts, so I will move to the next slide.
It has been a great and wonderful learning experience for me. I have been able to learn about mediation, about the consent, stress management. During my e-learning training, I have been able to incorporate some of the rules regarding mediation as a case worker, and regarding the consent, I have learned about the stress management.
Thank you for providing us with this opportunity, and we were able to identify the areas of improvement for our organization and advocacy point at department level, provincial level, and national level. Thank you.
Thank you so much.
It has been a great and wonderful.
Can we move? Okay, so going forward, of course, this is not the end of the story. We yet to invest on it. We have to keep investing on our capacity building as a country. And gender-based violence is now taking different shape. We were not talking about TFGBV back in 2022. Now we are talking about TFGBV, which is incorporated within this curriculum as well. There is a module on technology facilitated GBV, and it's taking different shapes. The mechanisms are changing, and resources understanding of GBV case management is changing. So going forward, we use GB and AJK so that government in these provinces also has like sufficient number of trainers to do it in-house. That's one thing. We have Farhad mentioned, one training or a few training refreshers, they are not enough. There should be continuous engagement, and for that engagement there will be like training institution in Punjab, in KP and other provinces which governments, HECs. So these are our plans going forward on GBV case management. With this I'll stop here. Thank you so much.
Thank you, Dilshad, for sharing this incredible journey of achievements, capacities, and important reflections on strengthening GBV case management. Following this, now we would like to ask representatives from all the involved partners to share their insights. They will be sharing stories and thoughts on how they have contributed to advancing GBV case management initiatives. Their contributions will towards improving and